Welcome to our fourth webinar series and good afternoon. So thank you for joining us today, Dr. Dan. Today, I mentioned that Dr. Dan's going to be talking about managing some foot health and some of those tips and what to look for and how to manage that in the feed yard setting. So Dan, I'll turn it over to you and your McDonald's Wi-Fi.
Yeah, thanks. I'm working from my new office nowadays as a feedlot consultant and consultant for packing plants and different things. So I've been in central Kansas this week, and so my office is my vehicle, and I've robbed Wi-Fi wherever I can. But you know, I've spent a lot of time in veterinary practice and research, and we focus so much on BRD, and we focus so much on nutrition, and one of the things that I think that when I came to Iowa and started consulting yards in Iowa, I really learned a lot about lameness, and whether it's foot rot or hairy heel wart or toe abscesses. It's something that we have to deal with, and anybody that's dealing with cattle coming out of this weather that we've had in January, not only did we have foot rot issues in yards and hairy heel wart, but we also have exhaustion and injuries just from these big cattle moving in this quagmire. But we're starting to dry. We're getting some warm days, but we'll talk some about lameness. I think about lameness now as maybe something that we can actually do something about. There's some of the things that we get into in feed yards with respiratory disease and and digestive issues, and lameness has been put on the back burner, but it is a significant impact on death loss in yards, a significant impact on railer losses, and just performance and hot carcass weight robbers all the way along. So if you take a look at our other fellow protein industries, the poultry industry, lameness is probably one of their number one health issues. The swine industry now, and sow longevity and market hogs becoming more and more of a front burner issue for welfare. But as we ask these cattle to perform faster and get bigger and have larger outweights, having that support and having that the legs underneath them to be able to move becomes more and more of an issue. Just some of the economic impact that if we have foot rot in the last for these 220-day cattle, if we have foot rot in 120 to 200 to finish, you can expect to have, if you're going to finish that animal at the same outweight, it's going to require an extra 2 weeks of putting those cattle on feed. And typically we don't do that. We just sell them lighter. And even worse, we'll get a foot rot case and we'll just put it on the next load that's going out. So when you start to think about the factors of what that costs us, preventing it and doing some measures really isn't that much. We did a study or a survey a few years ago. Dr. Shane Terrell did his PhD with me. He's now a business partner of mine. But we asked feed yard veterinarians, nutritionists, and feedlot managers some questions in a survey to better understand what the perception of lameness is in the feed yard, and what are some of the economic and prevalence. We got 147 responses, 63 feed yard managers, 50 veterinarians, 40 nutritionists, and a lot of them consult a lot of yards. So in that survey, what's the perceived lameness morbidity? The response was about 3.8%. And I think that number really changes depending on your geography and the history of your feed yard. There are some feed yards that I would guess would say that we have a 40% morbidity rate to hairy heel wart if we don't put the right prevention in. There's, the 3.8 is pretty low. But the biggest causes of lameness that were identified were foot rot and injuries. And I think that not only depends on geography, but it also depends on your cattle feeding confinement area. Are you in a deep pack barn? Are you in slatted floors? Are you outdoors? Do you have, some of the worst foot rot cases or outbreaks I've seen is a very arid in Arizona where it's very dry, but we put up shades where they were too small, and all the cattle come up underneath the shade all day long. The shade doesn't move with the sun. We get urination, defecation. They stand in that one area and they just soak their feet, and then we wind up getting foot rot and issues. And so it's not just where you're at or what kind of facility you have, but it can also be geography. And sometimes some of the things we do for a positive outcome have some negative implications. When we asked the feed yard managers, you know, what do they use at a pen level to identify and pull cattle with lameness? And 41% said, hey, we pull anything that looks lame. 27% said we pull anything that's lame with significant pain or depression. And then 18% say we pull anything that's lame and if it's having a decrease in performance, and 14% had no protocol. And I would say probably somewhere in between these is the real answer. I was taught when I first got into feedlot consulting is you don't pull a lame steer unless it starts falling behind the pen. Well, as you're going to see from some of this, that was bad advice. Um, and we'll get into that just a little bit more. We asked then, when you get in the hospital, when we pull that animal to shoot, what are some of the things that you're doing to get a diagnosis? And you have to remember, back when we were in vet school, they told us that 90% of lameness is in the foot. So when we start identifying a lot of things in upper limb lameness, I start to question if we're doing the proper diagnostics at the shoot. But when we asked feed yards and veterinarians and nutritionists and managers, they said 48% said they palpate the foot or the joints. 60% said they pick up the foot to visualize, and I would call BS on that. I mean, I've seen people with the best intention. It is, if you don't have a tilt shoot and you have 1,500-pound animals, it can be without the right equipment and without some ropes and pulleys. That's a tough ask. Picking up the foot and using hoof testers is 20%. Just visualizing the foot, the joints in the upper limb, 90% say they do that. 2% nothing. And so again, I'm sure we look at them. Palpating them is less invasive, but picking them up is the right answer to get the right diagnosis, and we'll go through some of that. We break down lameness into basically two categories: infectious causes and non-infectious causes. And the infectious causes would be digital dermatitis, hairy heel wart, and foot rot, which is caused by Fusobacterium necrophorum. Non-infectious would be injuries, toe abscesses, sole abscesses. Okay. And so we asked the survey respondents, what are the biggest risk factors for infectious versus non-infectious? And for infectious causes, pin conditions, pin surface, and weather patterns were the three tops. So muddy conditions, and not grooming pins, and the pin surface being rough with these ice chunks and different things. These are all issues that lead to foot rot and hairy heel wart. When we asked about non-infectious, the big ones that popped up were cattle temperament, cattle handling, and surface of where you're working those cattle. Okay, so this one, as cattle get flightier, we'll talk more about toe abscesses, but we start to see more abrasions and more defects to hooves. So understanding that is important. The first thing you got to do is be able to find one in the pen early. And so Dr. Terrell and I did this for Zenpro Corporation years ago, and Dr. Chris Reinhardt, where we developed what we call the Step Up program. And the Step Up program, the first thing we had to do was go out and establish locomotion scoring. And it's really quite simple. In an animal that is clinically normal, based on locomotion, has a 0 locomotion score, their back foot should land where their front foot leaves. So the normal stride is that back foot, the front foot's coming up, the back foot lands where it was, and they have good mobility. A mild lameness, the first thing we'll see is a shortened stride, meaning that when that calf goes to, or that cow or that steer goes to move, if their back foot is landing a lot shorter than where the front foot left, we've got a mild lameness or a locomotion score 1. Moving on to a number 2 is not only do we have the shortened stride, but now we have a head bob. The head bob is generally more pronounced with a front limb lameness than a rear limb lameness, but it is more pronounced in a more severe case, regardless of front or back legs. I can tell you this, that if you're trying to figure out which one they're lame on, which front foot they're lame on, the animal will move their head down with the sound, same way with a horse. So if they're bobbing their head and moving, their head is going down when they land on the good leg, down with the sound, and it's coming up when they're on the bad limb. Then we move to the most severe, which is a 3, and that's a really pronounced head bob, but really they're not putting any weight on that limb at all. So 0, 1, 2, and 3, and that's important to understand because we went out then after we trained feed yard cowboys and trained personnel to find cattle of different severity. We went out, had them pull all the animals that they found were lame, give them a severity score of the lameness, and once we had that, then we looked at case outcome. And what we found, first of all, in our surveys was when we start truly diagnosing the animals at the chute and using hoof testers and picking the feet up and looking, we could get good diagnosis. The thing that surprised us the most when we started charting the outcomes of things that you don't typically associate death loss with lameness, but the mortality rates in foot rot cases across these feed yards. And again, I should have backed up. This was a study population of 250,000 head over a 12 months period, and that's the size of the cattle feeding operation. But total number of cattle that went through that operation in a year was over 500,000. We had 12% mortality rates in our foot rot cases. We have a 28. I don't think it's as much of a stretch that if we have septic joints like you would see in a mycoplasma or histophilus or any kind of sepsis, we even see it from Mannheimia and from Salmonella, that we had a 33% case fatality rate or mortality. Toe abscesses was a 15% mortality. So what I'm trying to get at is that a lot of times we don't associate an animal that's limpy gimpy similar to what we would find if we found an animal with respiratory disease. And these numbers are very similar to what we would see for case fatality rate for BRD. And what does everybody say about BRD? Pull them early, treat them early, you get better case outcome. Well, we tracked the treatments of, regardless of what the cause of the lameness was, if animals were treated at a locomotion score 1, we had a 10% mortality rate. If we went from a 1 to a 2, the mortality rate doubled. And if we went from a 2 to a 3, we were at 33% mortality rate. So identifying cattle, don't wait to pull them, get them in, get them treated. We have much better opportunity to have those animals return with a successful treatment than if we wait. So at the end of the day, what we learned in our studies was early detection, early intervention equals better treatment success. The major causes of lameness are very treatable if we treat them early. Foot rot, toe abscesses, lacerations. If we don't get there early, we're looking at animals that have significant swelling. They have septic arthritis. They have clubfoot. Those animals don't respond. It's too late. That's like a chronic BRD case. And you know, most of our lameness is going to be in the foot. So picking up those feet is important. Um, I just want to go through a little bit. If you looked at this, if something walked up to you looking like this, you'd think this is a bird. You wouldn't think this is a bovine foot or hoof. And so thinking about how cattle walk and what they walk on with two toes, 4 feet with two toes per foot, is really, really important. And understanding that the end of the toes is back where we would consider for us to be our heel of our hand or the heel of our foot. But in reality, for cattle, they're just standing on their toes or on their fingers. And so that's the reason why these hooves and this movement, they're so fragile. And the one we're really worried about is P3, or the tip of the toe that is in the hoof wall, um, that 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 can cause some issues when we get toe abscesses. But I think it's really important to understand this. Other areas that are important to understand, uh, just common terminology, is up here at what we would call a wrist is the fetlock. The pastern is between the hoof and the fetlock. We have the hoof wall, which is the outer hard surface of each toe. And that hoof wall grows from the coronary band. The coronary band is kind of like the cuticle of your nail. And that's where that nail bed is, where the hoof wall grows from, where the skin and the hoof wall meet is the coronary band. And that hoof wall is hard and it grows down, just like a fingernail growing out of your finger. The sole is in the bottom picture. When we pick it up, the sole is still hard, and it becomes harder. But the thing that's important to understand about the sole of the foot is that it grows separately. It's not connected or grow with the hoof wall. It comes out of the sole, the bed of the sole, out of the bottom of the foot, and it grows out. And so why is this important? The reason why this is important is that between the hoof wall and between the sole, there is a line where those two aren't really connected, but they're very, very tight together. And that's called the white line. And the white line is the line of demarcation between the sole and the hoof wall. So we'll talk about a little bit about why that's important when we get to toe abscesses. This is just another picture, and you can see where that P3 or the last digit of your toe, or the last segment of your P3 is the end of your finger, P2 is the middle bone of your finger, and P1 is the top, is the bone of your finger closest to your hand. Same with your toes. And then look at that white line. You can see the white line is down here on the bottom left part of that. That is the separation between the hoof wall and the sole. And that has the ability to track some manure and causes some issues. So the general guide to lameness exam is, the first thing I ask is all the lameness. If let's say you have 20 head of calves that are lame, the first thing I'd ask you, is it on one side of the body or is it on both sides? And you'd say, well, it's only on the left side. If it's only on the left side, we have a facilities issue. And we need to go through the facility, and we need to look for places that cattle are either stepping in something that's causing a traumatic injury, or find a place where they're being stuck, like in a single file, a loadout chute, a snake to a working facility, a chute, an alleyway, someplace. If all of them are lame on the left side, I walk from our loadout through our processing facility looking for something that's on their left side that's causing an issue. Now, if it's on both, we're going to do a clinical exam. And in that clinical exam, we're going to bring the calf in the chute. And the first thing we're going to do is pick the foot up. And when we pick the foot up, I want to make sure I have good enough light so that I can see between the toes or see on the back of the foot. And so we're going to have, we're going to go into we're going to pick the foot up. And the first place I look is between the toes. That is where foot rot is going to be prevalence, and foot rot will be the toes will be separated a little bit. It'll be inflamed in between the toes where the skin is, okay, and it'll have a very foul odor because it's fusobacterium and it's an anaerobic fermentation. Okay, if it's not there, the next thing I'm going to look is in the pastern area, and I'm going to look on the backside of the hoof, just above the coronary band in there, and I'm going to look for a strawberry type lesion. And that strawberry type lesion would be synonymous with hairy heel wart or digital dermatitis. If I don't have foot rot and I don't have digital dermatitis, then I'm going to pull out hoof testers, and I buy hoof testers for all my feed yards, and I leave them there. And what you do then, if we don't have foot rot, we don't have digital dermatitis, we're going to apply the hoof tester. If I have generalized soreness in one claw and not the other, then I'm thinking toe abscesses. If I have a very specific sore or a very specific spot in that hoof, when I use the hoof tester, that I get the animal retracts the hoof or flinches, then I'm starting to think about a sole bruise or some sort of hoof abscess. Okay, toe abscesses generally across the entire hoof. Sole abscesses are specific. So those are some things to get to the right one. We want to pick up the feet. We want to wash them, and now we'll get into some of the different areas. Okay. This is one. This is a very severe foot rot case, extremely spread apart. Foot rot has been the bane of mud and feed yards for years. Very easy to diagnose. Okay, when we get them in. Treatments. We have very many. We have a lot of drugs that are approved for the treatment of foot rot. They all work extremely well. Difference between case success and treatment failure is making sure that we treat them early. I treat a lot of foot rot with biomycin and LA200. Just a ton of it. Works great. Just remember, if you don't already know, over-the-counter drugs are gone. Work with your veterinarian to get a prescription. There are commercial vaccines available. We've done research on foot rot vaccines, just like liver abscess vaccines, and we just haven't found a good commercially available product that we can demonstrate efficacy. We'd love to have one. It's just really a hard place to get an immune response and a really hard place to get control between the toes. The main prevention for foot rot is going to be grooming our pens, getting rid of mud holes, not creating bogs, man-made or otherwise. Understanding that cattle are breaking through the ice on semi-frozen manure. It breaks the skin, but groom pens, and burn more diesel is prevention. Hairy heel wart, digital dermatitis, same. We use those. This is the typical stance that you'll find a hairy heel wart calf standing in. They'll stand on their tippy toes because the lesion is back behind the hoof. You can see here that it's in that skin area, and so they don't want to step down because that stretches the skin on the back of the hoof, and that's very, very painful. Okay, you'll see calves that when they first get digital dermatitis, they'll stand up and they'll act like they're trying to kick manure off their foot. And you'll see them, and start to see them walking on their toes or standing on their toes. This issue is caused by a treponema or a spirochete, and it resides in the gut of the cattle, and we wind up getting it in the manure and in our facility. But again, we got to have something that disrupts that skin that then leads to the infection. Terry Engelken's work showing that a lot of times foot rot or fusobacterium infections at the beginning of hairy heel wart that then allow the spirochetes to come in as a secondary invader. So anything that works to help prevent foot rot also helps to prevent hairy heel wart. These are just the different stages of hairy heel wart that you can see going from the top left to right and then bottom left to right. They get very angry as they progress and very painful. And then they'll turn into a chronic lesion. They'll scab over and turn into a chronic lesion. And these hairy heelwort is extremely responsive to treatment. The big thing is you got to make sure you get that lesion cleaned up so that you can get good contact with the agent that you're going to treat with or prevent with. And we'll talk just a little bit more about that. So treating these animals with a systemic antibiotic, this is why diagnosis is important. I can treat foot rot with a dose of biomycin, but if I give a dose of biomycin and it was hairy heelwort instead of foot rot, I'm going to have zero efficacy. Instead, when it's hairy heelwort, we need to clean it. If you want to use antibiotics, you can take biomycin, spray it on a gauze pad, place that against the lesion, and then wrap the foot, and that'll be effective. If you have a tetracycline gel, you can use that, and that will also be very, very effective, and you don't need to wrap the foot. Other topical products that are on the market, there are some non-antibiotic products called Heal Max and Quick Hit, and you can spray those on the lesion, and those will. And we've heard everything from putting them on in with big squirt guns and walking through the pen and spraying cattle when they go to the bunk to treat, to pulling cattle up to the chute, picking up their foot, treating them individually. But I would say now our recommendation is more that if we have a hairy heelwort case in a pen, we know how fast that's going to spread. We're just recommending that once we see it, we run them through a foot bath. Okay. And we'll talk a little bit about the foot bath and what's in it coming up right here. So pen cleanliness, if you have a hoof trimmer or if you're using equipment to trim hairy heelwort between animals with your contaminated equipment. So be careful not to do that. Um, we recommend timely foot baths, and when we look at timely foot baths in buildings or feed yards that have chronic issues with hairy heelwort or digital dermatitis, we're recommending that the cattle go through the foot bath every 28 days. And we're using either 5 to 8% formalin or 10% copper sulfate. And if I get into a feed yard where we only see issues at 120 days, generally speaking, what we do is we wait until that pen has some hairy heelwort diagnosis, and then they go through the foot bath, and then they are put on the monthly foot bath regiment list. Because if we don't do it every 28 to 30 days, I can assure you at 30 to 35 days on feed, you're going to start seeing hairy heelwort in that pen again. Now, if you're someplace out west and you have really dry conditions and really hot temperatures, you may get away with treating the pen once and not having it come back. But if you're in the upper Midwest and you get it in a pen, I'm telling you, you're going to have issues with that until those cattle go out. We make sure that the foot bath that we build, a lot of times we build them alley width wide so that we can drive the cattle through them one direction and bring them back through another. We make sure the foot bath is 8 inches deep so that we can get it up to the fetlock and get a good dunk. We want to dunk each foot twice and understand splashing can be an issue. We use a lot of formalin. And part of the reason we use formalin is, number one, it's extremely effective. It's not very expensive. And it doesn't cause us any environmental issues when we go to get rid of it. The copper sulfate does. And so for treatment, we're taking the pen through the foot bath because we know we're going to expect more. And there's undiagnosed cases that are going to be in that pen. And then once they go through the foot bath, they get put on the list and they're going to go through this. Another thing, if you're going to clean pens, make sure that you get rid of any standing water in the pen to prevent foot rot or digital dermatitis. You want to clean underneath your fences. If you don't push out from underneath the fences and you don't have shades, cattle go and they'll stand around where you haven't pushed out because they're catching shade from the pipe. And then when we have rain, the water stops where we haven't pushed out underneath that fence. And we are creating that bog, like I talked about with the inappropriate shade space, only it's just around the outside of the pen. There's been papers that show that cattle or horses and people can track this spirochete on their boots or on their hooves. It's really hardy. It survives in the dirt, and so it seems like once we have it in a facility, it's hard to get rid of. I have people say, well, we spread lime between every group. Well, for years we've spread lime between groups thinking that we're doing some good. And what we've found from our poultry friends is that a lot of these foot issues or bugs that cause foot issues love a basic environment. And spreading lime just provides a more basic environment and actually gives them an environment which they survive better in for the next group. So we're looking at some acid treatments and that to help treat some of the issues. Sole abscesses occur, and again, that's pinpointed. You're going to grind the bottom of that foot, get to where that abscess is, and then relieve it, and just poke your hoof knife through it, get it to drain. We're going to put a glue and a block on the good toe, so the animal has at least a couple of days. My blocks seem to fall off right away. I got to get better at that, but blocking that foot will provide some relief off the bad toe. And we're using more and more of those in the feed yard. So toe abscesses. So toe abscess is an abscess of the inside of that hoof wall. And so when cattle are really flighty, they tend to want to get to the middle of the pack. If you're working them through a tub or you're sorting them back off of an alley, if you've noticed, they're always trying to push and get to the middle of the pack. And the wilder they are and the more crazy you are handling them, the harder they push. So most of the time we see toe abscesses on the hind limb, okay? And what we used to think was an abrasion against concrete. And what we're finding out from Murray Jelinski up in Saskatchewan, he took hooves of cattle, put them on a hydraulic uh, 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 press, and he kept applying pressure, and finally got to a point where he applied enough pressure that white line opens. So the sole and the hoof separate. As those animals are up on their toes trying to press and get away, that white line opens. And when that thing opens and it's a manure environment, guess what tracks up on the inside of that hoof? And so that separation of the white line, usually the medial claws on the back feet cause our toe abscesses. We a lot of times don't see the toe abscesses for 21 to 28 days. So we have sale barns or auction markets that we're constantly tracking, that if we have flighty cattle and they have some concrete alleys and they have people that are not very good at handling cattle, we'll see a lot of toe abscesses out of certain auction markets. And so we track that. And again, a lot of times it shows up 21 to 28 days, and you're going to say it's a stifle issue when you see it. But I guarantee you, if you examine closer, you'll find out that these are toe abscesses. As the toe abscess progresses, that hoof wall is really, really tough. So that abscess has got to go one of two ways. It's either going to come up to the coronary band and it's going to rupture just above the hoof wall, or it's going to track up the lymphatic system, up that leg, and start giving you hock, stifle, and hip issues. What we try to do, I tell you what, if someone came up and said, well, I don't do anything for toe abscesses once they have it, I'd say I'd be okay with that. If they came up and said I tip the hoof, I'd say okay with that. And if they said I amputate the claws, I'd say great. Because I don't know that any of the three lead to any better outcome. And we've tried about everything. If we tip it, you don't want to tip the toe too much, like I've showed here. You just want to get it to where just a bleb of blood comes, because we want to have a piston-like effect that when they step down, they're expelling the bad stuff, but not sucking in more manure. If you tip it too much and they aren't wrapped, they just wind up packing manure in that toe, and it just, our case fatality rate's not very good. on toe abscesses. So prevention, calm, quiet cattle handling. We are putting more animat and double D mats, not only out in front of our chutes, but we're putting it in our tub systems. We're putting it in our snakes and lead up alleys. We've even gone to some facilities where we put wood chips from the lead up alley through the tub, so that those cattle have something that moves and they can stand on. But understanding the docility of the cattle, understanding the how, the higher strung they are, the more care we have to. We should always use low stress cattle handling, but that's the best ways to prevent it. So I'll wrap up with this. 90% of lameness is in the foot. We have two types: infectious and non-infectious lameness. Pen conditions, weather, and grooming pens, and looking to remove the environment for hairy heel wart, and making sure that we scrape our barns, making a good bed pack in the middle, weekly cleaning around the outside. All these types of things are what are going to lead to improvement and prevention of foot rot, hairy heel wart. Non-infectious, remember trauma. If all the cattle are lame on one side, I'm looking for something that's sticking out, or they're stepping in, that's causing an issue. Toe abscesses, low stress cattle handling, high strung cattle, good footing, rubber matting, are all good for prevention. And then on the treatment, the biggest thing, if you take home anything, is regardless of why we have lameness, treat them early, get them in, use the antibiotics, bring them in, get a good diagnosis so you know what you're treating. And if you know what you're treating and you pull them early, we have really good success on our infectious uh, foot issues and lameness. So with that, I'll stop sharing